my turn. I look a little.
All right.
Great.
This Lunch and Learn is now being recorded, and we are going to be discussing CMV today, and I'm going to let our guests talk more about that. So we have 3 special guests today, and they're going to be taking part with our moderator, Tabby. My name is Janelle Frost, and I'm the Director for Michigan Kids and Voices, and I'm just going to be behind the scenes. If you have any questions, you can go ahead and jot them down in the chat box, which is, if you scroll down the bottom of your screen, you can get on the chat and post those questions there, and then we will get to those questions at the end of the Lunch and Learn. Gabby, do you want to go ahead and introduce yourself as our moderator?
Yes. Hello, my name is Tabby Bellhorn. I am the Executive Director for Ohio Hands and Voices and the ASTR Coordinator here in Ohio. I'm really excited to host this panel today with our guests. We have Teresa and Tia and Andrea, and I think I saw Axel there for a little bit as well. So I'm really excited to talk to you guys about CMV today and hear your different perspectives. So I'm just going to ask a few different questions, and we have about 30 minutes today. We're just going to kind of have a discussion so people can learn about CMV from parents and from advocates, and how we can all work together. So if you wouldn't mind, if you could just take some turns and just tell us briefly about you and your family, where you're from, where you live. We do have people from, we're across our Hands and Voices region here, so we're not all from one area. And how many children you have, and which child or children may be affected by CMV. Andrea, do you want to start?
Sure. Okay, so my name is Andrea. I am from Illinois. I have one son. His name is Axel, and he is my child that is affected by CMV.
Wonderful.
Is that all your questions?
Thank you.
Sorry.
We'll get to more later. It'll be great. Tia, how about you?
All right, I am Tia Bexell. I live in East Lansing, Michigan. I've been here for just over a year, and I have 3 children. They are 15, 13, and 10, and it is my 15-year-old who was born symptomatic with CMV.
Great, thank you. And Teresa, can you tell us a little bit about you?
Sure. So my name is Teresa Bowman. I live in Columbus, Ohio, and I do not have a child with CMV, but I work with Heather Innes in Ohio, and she has a son, Ethan, that's 12, that has CMV, and we're kind of co-partners in Ohio to spread CMV awareness and work on different projects. And Heather is working right now. She wasn't able to make the call, so she asked me to speak in her place just on my experiences in Ohio.
Great, thank you. Well, Teresa, I think I'm going to start with you and pose this first question to you. I was just hoping that for people who may not be aware or know about CMV, if you could tell us a little bit about CMV.
Sure. A little bit of background is CMV is a cytomegalovirus, and it is from the herpes strand of viruses. It's very common. It presents with flu-like symptoms, body aches, and to normal population, it only amounts to that much, just a flu virus. However, pregnant women are at an increased risk when they contract the virus because it can cross the placenta of their unborn child, and it actually attacks the nervous system of the unborn baby in a variety of ways in a large spectrum. So one thing that we are working towards with spreading awareness is only 9% of women know about the CMV virus and know how to avoid it. So what we're trying to do is spread awareness about not sharing bodily fluids with toddlers who may be carrying the virus while you're pregnant, and therefore increasing the risk to your unborn child of contracting the virus and having the neurological deficits that are associated with it.
Great, thank you. So our parents, Tia and Andrea, would you mind telling us what were some of the signs or symptoms that your child might have CMV, and how was it diagnosed?
I'm gonna go first again.
Sure.
So long story short, when I was pregnant, I was due with Axel in July, and in April I got like a cold, illness, coughing, runny nose, sore throat, that type of thing. I called the OB, and the OB was like, here's some cough syrup and we'll see you at your next appointment. Like, it's fine, no big deal. So it just so happened that 2 weeks after that, I was going to the high-risk doctor because I had polycystic ovarian disease, and they were looking over Axel's heart, and he kept looking and looking and looking, and told me that Axel had coarctation of the aorta, and that he would need open heart surgery at birth. So we went down a path of heart defect, and everything was related to his heart. As the weeks went on, he stopped growing, he stopped moving, and they just kept saying, oh, it's because he has a heart condition, and that's typical for babies with a heart condition, and never really looked past that. And then when Axel was born, we were preparing for heart surgery, and they took his blood, and they said, wait a second, he has some type of infection, but we don't know what it is. So, we're going to put heart surgery on hold, and we need to figure out what this infection is before we expose his heart to the infection. So they investigated it for a little while, and then they eventually diagnosed him with congenital CMV. And as they were treating the infection with like a general antibiotic, his heart, there's never a good word for this, but his heart, the arch of his heart was very swollen. And as the antibiotics started to treat his heart, the arch was no longer swollen. And he never had a heart condition. It was just that his body was trying so hard to fight off the virus that all of his heart swelled up and made it look like he had a heart condition, but he did not. So that's kind of where our CMV journey began. Heart surgery was no longer an issue, but all the things involved with CMV now became a big deal for us and our family.
Wow, that's really interesting, Andrea. How did you feel at that moment when you found out it wasn't a heart condition, but it was CMV instead?
The way that they presented it to me at first, before they really knew anything else, was very almost like, oh, he has CMV, but these just a couple of things that can happen, but we're not really sure that those things are going to happen. So for us, we were like, oh, thank God. Like, we were, we had planned for 8 months in the hospital after heart surgery. We had planned, for all those things, and we knew that there was a possibility that Axel wouldn't make it out of heart surgery. So to take a step back and to take the heart condition off the table was huge for us. The only other bad part about it was at first was that my sister, my brother's wife, my sister-in-law, was pregnant at the same time as me, and she was due 3 months after me. So when they told me that Axel had CMV and that they were explaining it to me what it was and how it was spread, I was terrified for my sister-in-law because we had spent our entire pregnancies together. We'd gone on 3 vacations together. We always had family dinners at our house. Like, we had been together. So that was a huge setback for us because I was really worried about her and her baby. And he did not have CMV when he was born. And she actually, that day that Axel got diagnosed, she went to the doctor, and the doctor didn't know what she was talking about, and they tested her for mono instead of CMV. And anyways, so that was what was the scariest part.
Interesting. That's a very interesting story. And I think also just indicating among doctors that there's not even a great awareness of CMV. Interesting. Thank you for sharing, Andrea. Tia, how about you? Can you tell us what were some of the signs or symptoms about your child's diagnosis and how she was diagnosed with CMV?
Okay. Well, I can tell the same thing about the end part of my second trimester. I had what they thought was a cold or allergies and just kind of said, take some cold medicine. And I was expressing like really a lot of fatigue. I was going to work, but it was, oh, it's your first pregnancy. You're working, you're fine, take a nap. And I did. Took lots of naps. But when Lorelai came, she was 9 days early. I went to the hospital. She was born very quickly. And immediately she was small for gestation, and she had the raised blueberry rash. So the specialist was called, and within 15 minutes, she stood in the corner of the birthing room and said to my OBGYN, CMV. I work in special ed. I'm very aware of CMV. I had been tested when I found out I was pregnant. I was aware I did not have the antibodies. And I was very careful at work. I worked with preschoolers through 5th grade. And at work, again, I will stress, I was very careful, but probably not out in the community. I didn't really think about it as much. And somewhere along the way, I had contracted it. So she went to NICU for a week, a lot of testing, and she by all means had a lot of the symptoms. Again, the petechiae, the blueberry rash, the small for gestation, and then the testing continued. That's the diagnosis. Okay. You want me to keep going?
Well, we have some more questions, so I'm sure you can tell us some more. Okay. That's interesting. I'm curious how, so working in special ed, I understand that. Is that how you came to know about CMV?
That is how
before your daughter was diagnosed?
I worked with several children. Yep, I've worked with several children with CMV along the way.
Okay, okay. Great, well, thank you. Very interesting. Okay, so Andrea and Tia, can you tell us what it's been like for you and your family raising a child with CMV, and anything really significant to your story? I know I love too that you're both kind of in different parts of your journey right now. So please just kind of give us a glimpse into your life. Andrea, do you want to start?
Sure. So when Axel was born, and all the things happened and he got diagnosed with CMV, we were devastated, but it was almost like, they would tell us, the first thing they said was that he had a hearing loss, or that he didn't pass his newborn hearing screen. And we were kind of like, oh, well, we'll take deafness over heart surgery any day. Like, that's fine. And I never really took the time to accept all the things that were happening. Like, then they, said that he had, like, they did lumbar puncture and an MRI and all these things. And they kept saying, oh, he has this, and he has this, and he has this, and he has this. And I never took the time to accept it. And then a few months later, I got really, really angry that nobody told me, and that when I found out, I could have tried to prevent this, or I could have been, educated on this and known the risks or the signs. And I was so angry. So at that point in our life, our entire family dedicated ourselves to, CMV awareness and education and outreach, and try to get involved in as many ways as we could. So to be honest, that was kind of my coping method, like to just be involved as much as I can. And the first year of Axel's life flew by so fast because we were doing so many things. I planned a fundraiser for the National CMV Foundation in the first year of his life. And we just kind of went along with whatever the therapists were telling us, and all that. So back up a little bit, he is in early intervention. And at first, when he first came home from the NICU, they told me that he only qualified based on a hearing loss because he was not delayed in any other areas at that time. And now looking back, I wish knowing that they would have started earlier. But anyways, so about 6 months after that, he started getting all the other therapies, PT, OT, speech, all of those things. So right now we have 9 therapies going on. And really last year, or not last year, over the summer, I guess it was, we really had to start prioritizing our goals and really start, accepting that the progress that we were seeing was slower than we thought it was going to be. And, it comes and it goes based on the day and things like that. So we have found that really prioritizing our goals and, really accepted where we are right now in our journey. But anyway, so Axel has multiple diagnoses. I'll tell you them really fast. He has spastic quadriplegic, cerebral palsy, microcephaly, calcifications on the brain, malformation of the brain, PMG, optic nerve hypoplasia, bilateral profound central neural hearing loss, global developmental delay, a motor delay. He wears cochlear implants. He has a feeding tube, and he has hyperplexia and a few others, but those are the main ones that we deal with. But as you can see, it doesn't stop him from being smiley and nosy and silly self. So, we have learned to take it day by day, and that's kind of where we're at right now.
Thank you. And we love that Axel's with you today. So thank you for sharing him with us as well. So, and to help others understand, that seems like an overwhelming list of diagnoses. And you seem like you have it all together and are handling it so well. Kudos to you. I can only imagine dealing with 9 therapies. Are all of his diagnosis a result of CMV?
Yes, all of them are subsequent to CMV, which is the part that makes you the most angry, right?
Yes, and what an amazing story that you turned your anger into advocacy. Yes, I'm excited just listening to you. So what you are going to be able to do and what Axel's future looks like. He's got a bright future with you as his mom, and I think this CMV awareness campaign as well. Tia, I'm going to move to you. So can you tell us more about your story and your journey? What has it been like for you raising your daughter?
It's just interesting watching Andrea because I'm in such a different place with Lorelai being 15 and remembering being there. Although my anger issue wasn't the same because, again, I had awareness of CMV and I did try actively to, prevent it. And there is a guilt that you have then because obviously you contracted a virus, and I know that I can't feel guilty, but there is that internal guilt that as a parent with a child with CMV, you have a guilt. So I've tried to move on past that. Now we're 15 years in. So I did leave the hospital after a week in NICU. I left on an apnea monitor. She was on an apnea monitor with lots of bad news. I was told she would probably need about 9 months developmentally. She has the calcifications. She actually left the hospital without hearing loss being identified. They checked her vision and she didn't have retinitis. So some things were looking good. Again, she was small. They were measuring her. They weren't saying microcephaly at the time, but we honestly went to the doctor to be measured once a week. We went to 2 to 3 doctor's appointments every week. And finally, I just had a conversation with a few of them saying, I can measure her head, and what difference does it make? I mean, if she has microcephaly, can you change it? And the pediatrician very kindly looked at me and he's like, you're right. You don't need to come here every week. We can't change it. And there's nothing we would do except label it. So come back when you need to come back for an appointment. Thank you very much for taking something off my plate. I had gone back to work. I had this newborn baby. The stress in my house was incredible, having an identification with my significant other, and he moved out. So the challenges became very real very quickly. Lots of doctor's appointments, lots of bad news. Again, you'd go to the doctor and again, they would identify, okay, now it's CP, now it's this, now it's that. And again, I had to fight for her to get services once she started not meeting milestones. At 4 months old, they did identify her with hearing loss, mild to moderate in her left ear. And she had a hearing aid by 7 months. We started going to a speech group. Her gross motor was not moving along at all. And again, my background is OT. So I was doing lots of floor time. I was doing a lot of therapy at home with this child. And it was, again, once she hit 9 months and the neurologist said, you have to stop being the therapist and you can only be the mom and she needs to get therapy outside, that hits you hard again. Because that was a reality. You know, again, I work in special education, and that future that I left the hospital hearing is coming true. So we got the therapies. I had to fight with Medicaid to get her on Medicaid. Again, without Medicaid, it would have been a real financial stress on my family. Just those copays alone add up so quickly. But I was able to talk the talk, having my medical background, and got her on Medicaid. And we started the therapies at 9 months, primarily PT. And then I was taking her myself to a speech group. We started going to the Delaware School for the Deaf. We lived in Delaware at the time, and they were fabulous, included us. She was the youngest one going to the Mommy and Me speech group. We were doing sign language. She was wearing her hearing aid, but gross motor still really, really delayed. Eventually, jumping forward, I had to really push PT to get more therapy, so they increased it to twice a week. And I worked with them, noticing that I went to a conference that I could get some more stuff going on with vision. Although she'd go and get tested, her vision was functional every 6 months, she had significant nystagmus. And she would watch Sesame Street staring at the ceiling. So I kind of wondered if that wasn't something to do with why she wasn't walking. It's hard to learn to walk staring straight up. And I pushed to go to I took her and paid out of pocket to go to a developmental optometrist, and she used Prism to help. And within a couple months, and a walker, she had glasses and she was walking with the walker and eventually walked out of the walker. So really fabulous, but I had to really push, and I really had to be able to talk my talk and advocate. And that is probably one of the things I can say the strongest at the beginning, in the middle, and at the end, and I still today. You really have to advocate for your child and have to know your mommy gut for your child. Every kid with CMV is so incredibly different. Depends on where you were when you contracted this developmentally for the child, but advocating. So she started walking at 2.5, without the walker, really close to 3. And 2 months after that, her balance decreased significantly, and she no longer could find us localized when we called her, and anxiety increased terribly in the child. And my gut was that her hearing loss had increased. And sure enough, we went in and she had gone deaf in her left ear now and had a very mild loss in her right ear. So that's age 3. We continued a lot of therapies, continued working on that strengthening, that balance. Going through the school system was a lot of challenge getting services because she was not cognitively delayed. They questioned the IEP, but she got physical therapy. They were ready to dismiss her from speech because she was very articulate. I questioned, she's hearing impaired and she had just had hearing loss. So they decided to be kind and work with me and keep her on. I really appreciated them going out of the way for that. But they kept her on. She continued to get some support. The school district where we went did not have an audiologist, and they would use their assistive technology person and their speech people. Nobody really familiar or utilizing a lot of the FM equipment. So we did a lot of trial and errors. I was connected with Delaware School for the Deaf, so the audiologist there would come over to meetings and help out and kind of advise them. That was a long road in our district as she continued through, and it got a little bit more challenging as she went off to, in first grade, her teacher put her through to go to a gifted program that was in the district. So obviously we moved way beyond 9 months. She is very, very academically inclined and bright. And the head of special education there calls them twice gifted when they have special needs and are doing really well academically. So it was pretty exciting to get her in that gifted program. And she has continued through there with a lot of struggles with accommodations. Lorelei also has some vision loss. As I said, she went through using prisms for several years. She no longer has the prism in her script. She does wear glasses still. Her vision is 20/50 corrected. So at school in her IEP today, she still gets the audiologist here in Michigan. She gets the vision. They're all on a consult basis. And her IEP has that all of her work is to be blown up to a 16 font, or for testing, lots of times 20 fonts. And that goes through to now she's taking the PSATs, and she actually, the last 2 years, is taking AP courses, so she'll get college credit for them. So that statewide testing, it's a lot of paperwork, and I had no idea about doing all of that. So the school has been very supportive, and they do that. They get the qualifying numbers, submit all the paperwork. So I think it's really important for her to stay on an IEP and get those kinds of support taken care of. They do that. They don't tell me how to do it. It's just done, and I receive a number. So those are the challenges that kind of come in if you let go. They've talked about putting her on a 504, and then in the spring, Lorelei herself identified some more hearing loss, and it progressed a little bit in her right ear. We're not quite sure where that is. So unfortunately, that's a lot of anxiety and stress on her. She will express going to bed at night, not knowing if she'll hear anything in the morning. She's into theater and music, and she's really concerned about that. She wears a crossover system now, and she doesn't like it. It's not functional for her. She complains about it. It overwhelms her on her right side with hearing when she goes to events. Even in the classroom, it can be overwhelming. So unfortunately, that doesn't seem to be the right technology for her. With the progressive hearing loss and not knowing how fast that might go, or if that stays stable again, she's been stable for 12 years. We are looking at going for a cochlear implant in her left ear, and that's been a mix. You know, she's had no stimulation to that nerve now for 12 years. So that'll be a long process, and insurance, she doesn't really meet the qualifications. So I'm hoping that with some of the more CMV awareness, that will help insurance see that there's a need for her to have that. Her balance is off, her safety awareness. You can sit beside her and at dinner and in a quiet room, just the two of you, and if you speak, just speaking forward, she hears nothing to her left side. So that's kind of where she is today. Do you have any questions from that? I kind of went fast and skipped around.
No, that's okay. Thank you. You also, what a story also. And I love hearing the stories of advocacy and what you've done and the progress that she's made. And you said, you know, to trust your mom gut. I think that is amazing advice that we as parents and moms especially, sometimes we just know something is off but we don't know how to articulate it or how to make sure that the professionals or within the medical field that they're hearing us. So I love that advice that you have shared. I have just a couple more questions and then I will wrap it up because we are coming up to the end of our time. But I know Teresa has been sitting there very patiently and very quietly. Teresa, I just wanted to hear from you a little bit, kind of how you got involved in your work with CMV and what the experience has been like for you. So if you could just maybe take a couple minutes, and then I'll have one last wrap-up question for each of you. So
sure.
Go ahead, Teresa.
So I am a NICU nurse by training. So I knew about CMV as a NICU nurse because we had patients that had CMV that I took care of. And then it kind of went away for a while. And then my best friend from college had a daughter 5 years ago who was born with CMV. And her story is very similar to Andrea and Tia's. She did not know until after delivery. And then once she told me about the information, I immediately jumped in. I knew what it was. I knew how difficult her path was going to be. And so I just tried to support her as a friend and someone in the medical community to kind of help wherever I could. And then unfortunately, when Kristen's daughter, Evelyn, was 20 months old, she passed away from CMV-related diagnosis. So dealing with her loss and trying to support Kristen and her husband, John, through that is where my advocacy really kicked in, and also stemming from Kristen's movement into advocacy as well to deal with, I think, her grief and anger and all of those emotions you spoke about. So I knew what CMV was. I knew how unfair it was that for something like this to happen to Kristen and Evelyn and John. So it just lit a fire, and I just knew I had background, I have access to people in my community, and I was staying at home with my 3 kids at that point. So not working anymore freed up time and energy to concentrate on CMV. And then once you kind of tiptoe into this world, you meet the most incredible parents, you meet the most incredible professionals who are committed to improving the lives of children with CMV and stopping the transmission as best they can. So it really snowballed into taking up a lot more of my time, and traveling to Vermont a few months ago for the national conference was amazing. And just working with this group of people to do whatever I can and help wherever I can has been extremely rewarding. And also, there's a lot to be done. So I'm empowered by the people that I work with, and also inspired to do more and to help as much as I can. So in Ohio, what we did is we applied for a mini grant from the National CMV Foundation, Heather Innes and I, and we got awarded it to spread awareness in Ohio. So we partnered with Tabby at Ohio Hands and Voices to launch a media campaign involved primarily with billboards around Columbus, and also outreach to childcare providers. And we're still working on that piece of it. But we have our billboards up. We're on our 2nd one right now. And we can track the uptick of hits to the National CMV Foundation site from Ohio and and be able to analyze the reach that we're having. And then we get those updates quarterly or every 6 months. So that's all coming in and being compounded and gathered together now so that we can present it at the end of our grant term, and hopefully pave the way for other states to do similar things, other mini grant awardees, and also within their own departments of health. kind of show what works and what worked for us, and where we can make a difference. So that's what we're doing.
Great, thank you. I'm Ohio Hands and Voices is so excited to work with Teresa and Heather on this CMV campaign also. So it is great to hear from each of you and your stories of advocacy, where you are at in your journey right now, either as a parent or as a friend. It's so inspiring to me. So thank you so much for sharing your stories. I do have one last question. And if you could just take like 10 seconds each and share any final thought that you want what would you want anybody to know about CMV? So just one final thought. It'll be easier if you go first. You won't have a chance of somebody stealing your answer. So just think about that for a second, and what's one thing you want others to be aware of?
I guess I'll go first. We just had shirts made when Axel, we needed a wheelchair van in our community, put together a fundraiser for us. And I designed a shirt, and on the back, it says Cytomegalovirus, and it has 3 ribbons, and it just says common, preventable, and 91% of women don't know. So those are like my 3 bullet points that I wanted people to see on the shirt and share. So that would be mine.
Great, thank you.
I'll go, and mine would certainly be advocate and educate. So if you're going to, you need to advocate for your child across all levels, education, in the community, in your family, but you want to educate when you advocate. So we don't end up with a community afraid of our CMV babies, because I think a lot of us go through that, and a lot of us with the medical field not being very aware get misinformation. So get the right information and educate.
Great, thank you. Teresa, how about you?
I think I would just echo both Andrea and Tia's comments, and also just say, unfortunately, this is a sad thing that brings us all together, and it doesn't have to be. I mean, none of this ever has to happen, and going forward, we can prevent, so many more families from having to deal with these similar stories, and every family counts, so everybody deserves the chance to avoid CMV and to be protected from it.
Great, thank you. I want to thank each of you for joining us today. Your stories were amazing. We really appreciate you taking the time to share with us. And Axel, thank you for joining us as well. Thank you again. We will post this recording online for others to see and share your stories and learn from. So thank you. Janelle, do you have any final thoughts that you would like to share?
Oh, this is Janelle. I think your stories were wonderful, and I thank you all for being so open and honest about this journey. It was quite insightful. So thank you, everyone.
Thank you.
Thank you.